All right, Henry Ford Health System is the only hospital in Michigan that will be doing this, but they're looking for volunteers to try out a COVID-19 vaccine. Let's talk about it. Check out our Detroit News playlist for more videos like this. Don't forget, we on Facebook, Instagram, Twitter. Reach out if you got a business question, inquiry, sponsorship, or video request. Keep sharing the videos. Appreciate that love, but keep sharing the videos. It's the best way to help out. It says the Henry Ford Health System is seeking volunteers to participate in this Moderna vaccine study. I think Moderna or Moderna, whatever they want to be called, is the ones that's producing it to determine whether a 2-dose vaccine could prevent COVID-19 infection in those who are exposed. The National Institutes of Health officials said Henry Ford Health is the only hospital in Michigan selected as a trial site for phase 3 of, the COVID-19. All right. But it said Henry Ford Health System is proud. They put something out, proud to be a part of fighting against the deadly virus, and said, one of their people name I can't even pronounce, Executive Vice President and Chief Clinical Officer of Henry Ford Health System, as one of the region's major academic medical centers with more than $100 million in annual research funding. Henry Ford is involved in numerous COVID-19 efforts with partners around the world. The study's first 2 phases, which includes 600 participants, includes that vaccine is safe, suggests that the vaccine is safe. The second phase shows that the antibodies were produced, whereas phase 3 will determine whether it can protect against the virus. The COVID vaccine study is made from messenger, mRNA genetic code that tells a cell how to produce protein. Health officials said while the protein is thought to help the body's immune system make antibodies to fight the virus, people may still become infected even when receiving the study's second dose. Okay, so it sounds like they're infecting you with the virus like the flu. Our best hope of controlling COVID-19 is with a vaccine, Dr. Marcus Zarfis said, Division Chief of Infectious Disease for Henry Ford Health. The Moderna vaccine seems to be very promising. In the initial studies that have been done so far, it looks to be safe and has produced protective antibodies at the level of natural infections. Okay. He said about 90 healthcare systems are looking across the U.S. for the 30,000 participants, and the enrollment will close when the number of volunteers is reached. Participants must be 18 years or older who are not immune or compromised, pregnant or planning to become pregnant, as long as they have not had the COVID-19 or another treatment. It goes on to say researchers are interested in recruiting those at high risk of COVID-19 infection, defined as adults whose location or circumstances put them at greater risk to exposure to the virus responsible for COVID-19. Adults who are high risk for severe COVID-19 based on their ages of 65 or older. Adults who are at high risk due to pre-existing medical conditions that are stable at the time of screening. Volunteers will also have a 50% chance of receiving the vaccine or placebo, which is a saline solution that does contain a vaccine. All right. If you're interested, I'll put the article link in the description for Click on Detroit. They got the link there where you can sign up. Each participant, health and safety are our top priority. They're saying, your participation in this trial could determine whether the vaccine can save lives. So, I don't know, people, they don't even want to take this vaccine if it's deemed safe by, the FDA or whoever it is, man. But I also read somewhere else, I can't remember where I read it, that they are offering $1,000 to somebody that volunteers. And I don't think 1,000 is enough, but there's some people living on the street that's poor or that's about to get evicted can use that 1,000. So, I think more they should be offering like 5 bands or 10 bands to go through this if they want to get people here. But me personally, I ain't fucking with it. I've been tested twice for COVID-19, you know what I'm saying? And I passed both times, but you still can get it. And I thought I had it in like February. I was real sick, and it lasted for a few days. So, if you're down for this, man, I'm not knocking you. Just be cautious. I mean, if you need the rack, it's iffy because they're giving you 2 different doses, and they don't even know if this is 100% stable or whatever it may be. So, I mean, they're always looking to come, and they looking for basically inner city people to do this. And I just don't think 1,000, if it's true, I don't think 1,000 is enough. and they say they think it's safe, and you really just don't know. I don't think nobody want to play with their life, especially with some people got kids or got stuff going on. So you might see people in compromising situations that might be on the street, that might be poor. And you know, there's people that's in high risk areas. You know, basically what they talking in code is they want people from the ghetto, they want people from the hood to come in and try this. You know what I'm saying? And like I said before, they trying to say that they're not shooting you with the virus, but in so many words, they shooting you with the virus, and that's how the flu shot go. I don't get flu shots neither. Fuck that. You know what I'm saying? You know, I don't really believe in their medical practices. I'm more of a holistic guy and believe in what they do. But sometimes you need the hospitals to save your life, and you know, I just know they always don't have the best intentions if your insurance ain't right or if you ain't got the complexion for the selection as well. So, you know, 1,000 just ain't enough, but we know we're going to see some of those CSL plasma people coming in there trying to get that 1,000 if somebody down bad, but, you know, that's crazy. I don't think I would participate in it, but, you know, hopefully they're successful. Hopefully it is a vaccine that saves lives and we can get back to our normal lives, man, but it just seemed like the overplay for the underplay, in my opinion, man, but they're looking for volunteers, 630,000 around the United States to come basically, you know, try this out. So let me know in the comment section, would you consider it or hell to the nah? You know what I'm saying? Me personally, it's hell to the nah. You know, if you ain't got shit to live for, you down bad and you broke, shit, I just don't see 1,000 being enough. That's not enough incentive. You know, you need to pay somebody 5,000 to 10,000. You know what I'm saying? Especially if I don't got it and you want me to, you know, inject me with it. It ain't 100% sure thing. Let me know what you guys think. Check out our current Detroit news playlist. Don't forget me on Facebook, Instagram, Twitter. You can reach out if you got business, question, inquiry, sponsorship, video requests. Keep sharing the videos. Want to make a donation? Cash App, PayPal, subscription. Best way to donate is share. Let me know what you think in the comment section one time.